When a myocardial infarction strikes, the blood supply to the cardiac muscles is suddenly restricted. Starved for oxygen, these muscles begin to die, and within minutes are unable to keep the heart beating. The cause of this life-threatening attack is the obstruction of a coronary artery by a blood clot, resulting in most cases from atherosclerosis, which in the coronary artery is called coronary artery disease or CAD. In patients with CAD, atherosclerosis can begin to develop decades before symptoms arise. Since atherosclerotic plaques grow slowly. When a plaque ruptures and a blood clot forms, the threat of a vascular event becomes very real. Clots consist of activated platelets stabilized by fibrin strands. While activated platelets aggregate to seal the rupture site, fibrin formation is triggered by the coagulation cascade. An important part of this chain reaction involves factor Xa and prothrombin. When factor Xa encounters prothrombin, it cleaves prothrombin into thrombin. One molecule of factor Xa can catalyze the activation of 1,000 molecules of thrombin, which cleave fibrogen into fibrin. Fibrin then assembles into strands. Thrombin also leads to further platelet activation via PAR receptors located on platelets, thereby increasing platelet aggregation. This activation doesn't only happen in the blood flow, but occurs predominantly on the plaque surface. Because of thrombin's effects on platelets and fibrin, it offers a specific therapeutic target for the inhibition of arterial clot formation. Vascular protection through reduction of thrombin generation is a promising approach currently under investigation for the prevention of myocardial infarction, stroke, or cardiovascular death in patients with CAD.
Hypotension apparatus. Reduce the pressure in and out. Therapeutic mechanism. The apparatus is a high-tech product based on modern biomedicine and Chinese medicine channel theory. It is a harmonious combination of ancient and modern principles. Structure and effect design under biomedicine theory. Bioelectricity therapy is used to control hypertension. The bioelectricity refers to electricity phenomenon in a living body. Bioelectricity exists in all living bodies in the nature, including human body. Diagnostic methods such as ECG, EEG for testing physiological functions and pathology of heart came into use. Feature. Applied with biomedicine theory, it is a self-operated therapeutic instrument developed for hypertension treatment. Compared with other methods for hypertension treatment, it bears the following features. Mini size, lightweight, no property, no magnetic, no external power, no time limit. Therapeutic effect can be obtained in minutes. Lowering blood pressure within 3 minutes. 2-direction regulation function. Quickly improves on hair loss and alopecia areata symptoms. A necessary product for health and happiness. Functions. Balances blood pressure, invigorates the spirit and refreshes the mind, relieves both headache and head distension from using mobile phones, stops headache and dizziness, controls hair loss and alopecia areata, enhances hair growth, lessens toothache, neurological toothache and joints pain, improves intelligence and enhances health, generates cosmetic effect. Caution. The patient should remain calm during the therapeutic operation and regulation. Use the apparatus for one treatment a day for 3 minutes at the frequency of 20 to 30 times per minute. For some patients, the effect is too slow. He may wash his hands first and then operate the apparatus to increase the conductivity. In a warmer environment, easy dilation of superficial blood vessels and opening of sweat glands is good for the smooth circulation of the closed circuit for a stronger therapeutic effect. Reduce the pressure in and out.
Whereसम्म कस्तो होला है यो यहाँसम्म लिन्छ पुरा
टल्लो पानी छ नि त्यहाँसम्म
पुरा ठुलो छ